Tell me what you see in this X-ray. Over here and over here. Hi, who am I? I'm Dr. Samir, an orthopedic surgeon who'd rather show you real cases than giving you fake gyan. So let's get into it. So, here's the X-ray. The straight line you see over here, it's not a fracture, it's not even a crack, it's a sewing pin sitting neatly inside the finger. Now the question is, how did it even get there? Well, this deserves a story. So somehow this guy happened to have a needle in his pocket. Somehow he put his hand in the same pocket. And somehow while shaking his hand around it, the needle just vanished inside his finger. This wasn't one of those cases where you can actually see the needle. No. This one had gone through and through completely and it was totally hidden. And that's why the X ray was the only way to confirm it. So the patient came in with just a tiny puncture wound. Maybe, like, this is just I'm imagining. It must have just been this small wound. But someone at some other hospital tried to explore it blindly. And what was once a dot turned into a cut and a laceration this big. Well, I think the correction should have been simple, which is don't explore blindly. In such cases, shift the patient to the OT, remove it properly. And that is the difference between minimal damage and unnecessary damage. So let me show you how it looked intraoperatively. So here's the intraoperative picture where you can see how big the laceration has become. You can see how the skin has been lost, and this is not a wound that will heal by itself. The needle wasn't the biggest problem anymore. This wound, this laceration became the bigger issue. And that's why blind confidence can sometimes hurt more than the injury itself. So finally, we removed the needle. I'll show you how it looks. This is us removing a needle, and this is how small it was. This is how it was done inside the OT under anesthesia. So, why this case? What is it that I want to tell you? So, this is the lesson. For patients, don't just go to the nearest doctor, and definitely don't go to the loudest one on social media. Go to the right doctor because sometimes the treatment can do more harm than the injury itself. For the young doctors, don't hide behind your degree. Don't mistake confidence for competence. Skill isn't proven by skill isn't proven by acting fast. It's proven by knowing when not to act. And I want to make this clear. I totally understand. Like, people make mistakes. Doctors make mistakes too. This wasn't a mistake of the intent. It was a mistake of skill, of not knowing what not to do. And I'm not here putting anyone down because none of us, not even me, not even you, are immune to mistakes. We have all made them and we will all make them again. That's the part of the medicine, that's the part of life. So instead of pointing fingers, let's focus on the lesson today. First, do no harm. Sometimes doing less is safer than doing more. So what happens next? The needle is out, that is totally fine, but the laceration from the previous surgeon will take time to heal. Because when the skin is lost, this much amount of skin is lost, this healing is slow. And one moment of overconfidence has now created weeks of recovery. So, I am Dr. Samir, fixing bones, breaking myths. See you in the next case.